My name is Michelle McLaren. Welcome to the ABCs of Health Insurance. I'm a licensed health insurance broker in the state of Texas with my own agency, Just the Facts Insurance Agency. And I'm also a licensed health insurance counselor. I'm here to help explain the confusion that is health insurance, especially for individuals. Insurance is evil. Let's turn evil into easy with answers. Today's letter is A. A stands for the Affordable Care Act, or the ACA. Originally, it was known as the Patient Protection Affordable Care Act, or PPACA, and then more commonly, Obamacare. This law was passed in 2010 and changed the requirements of what major medical health plans had to cover. The purpose was to make sure that people didn't pay for insurance that didn't cover what they needed when it was used, or could leave the patient paying so much of their health care that they went bankrupt. It also ensured that people who had pre-existing conditions could get health insurance at the same rates as everyone else. The law required that all American citizens obtain an ACA qualified health plan. This means it met the essential services. In my opinion, the ACA had the worst public relations department ever, because all anyone ever heard about was that if you didn't have insurance, you were going to get taxed. There's actually several good things in the law. There's financial help for wellness programs. Doctors and nurses who are willing to serve in rural or impoverished areas could get help paying off their student loans or paying off starting a medical business. And there were plans to research and figure out why health care costs so much in the first place. This is a law, not an insurance plan. The marketplace was created under this system to help you sign up for insurance and maybe give you a tax credit to help pay for the insurance, but they are not providing the insurance. There is no Obamacare insurance plan. There is no government insurance plan under this law outside of Medicaid and Medicare. For individuals, and this means people who don't get health insurance through their employer, the primary focus for this plan, the concept was great. People can get coverage for pre-existing conditions that aren't really their fault, like diabetes or cancer. They didn't get rated up for being overweight or under tall. And if they had pre-existing conditions, they could get coverage for those. Sometimes people got locked out of the system for conditions that happened years ago. I once had an 8-year-old in a family get rated up 800% because she'd had a detached retina at birth. It had been fixed, she was fine, but they wanted to increase her rates 800%. They can't have conditions denied or ridered out of a policy. I personally had insurance that wouldn't cover anything allergy, asthma, or knee related because I'd had issues with those in the past. And they could get maternity coverage. Before 2014, getting a maternity coverage on an individual plan was very difficult. The deductibles and the max out of pockets for plans were capped. I've had people who had $10,000, $20,000 deductibles, co-insurance on top of those. Now for 2018, the individual max deductible and max out of pocket is $7,350, $14,700 for a family. And while that is a big chunk of money, that's the cap, that's the max you're going to pay. There was no longer a limit on how much the insurance company is going to have to pay. I've met people who they had $1 million health insurance policy, but almost $2 million in medical expenses. So the health insurance stopped paying and they ended up bankrupt anyway. They added things. So mental health care is now required under the Affordable Care Act. Pharmacy care, cancer coverage, making sure that everything that you need is covered. And for people who make less than 400% of the poverty level, or about $48,000 for an individual, there are tax credits, which are paid in advance throughout the year, to help you pay your premiums. And if you make less than 250% of the poverty level, you can also get subsidies that help reduce your deductibles and max out of pockets. However, this whole law didn't quite work as well as they'd hoped. All of these great benefits cost the insurance companies money. And despite the tax penalty, a lot of people didn't jump into the system. You got to have a big pool full of people so that everyone swims around together to raise the water. The younger, healthier people said, I'll just pay the penalty which wasn't that high, and continued to not get insurance. So we had a huge flood of people who had pre-existing conditions, who were older, hopping into the system, increasing claims. Now, originally it was said it would take 3 to 5 years for that to settle out, and in this past year's reports, the insurance companies are making money on these plans. Some people would buy the insurance, have a baby or a pre-planned surgery like a knee surgery, and then drop the coverage, pay a partial fine. So that increased the cost to the insurers even more. So the insurance companies did something that I don't think anybody creating this law expected. They left. They said, no thanks, this industry isn't worth it for us, we'll stick with group plans. Some of them left the market entirely, some of them reduced the number of plans they had available, or decreased the size of the networks available to individuals. They raised the deductibles and maxes as high as the law would allow, and increased premiums also as high as they would allow. At the same time, the 80-20 law, part of the law, said that they could only spend 20% of what they bring in on premiums for all of their overhead expenses. So one of the first things they cut was commissions to insurance agents. This means that as the law is making things more confusing, as the industry is changing, there are fewer and fewer agents available to help people out. So this newly confusing system with less help. What a great way to go. The people who were hit the hardest were those whose income level is between 400 and 800% of the poverty level and are healthy. They make too much money to get a tax credit to help them pay for the premiums, but they did see their premiums go up. There's all those great advantages of the caps to the max out of pocket and the no limits, but if you're healthy, you don't care, you're not using it. So these are the people definitely hit the hardest in the system. But there are millions of people out there who were getting tax credits and who have coverage for pre-existing conditions or just coverage in general that they never had before. So that's good, right? What do we do now? That is an excellent question, and we've got hundreds and millions of people asking that question. No one is really sure of what the best solution would be. No one wants to give up the good stuff that the law brought into place, especially pre-existing condition coverage, keeping your kids on your insurance, making sure there's no discrimination based on your weight or your age. But the insurance premium increases and the network decreases are stuff that are really hurting some people. Do we ask the insurance companies to make less profits? That's not really something the stockholders want to see. One interesting little bit of trivia there, the Blue Cross Blue Shield companies, which are different companies all over the United States, by the way, are not-for-profit organizations. So they are growing, and you'll find them in almost every state, and they are the only company that covers the entire state of Texas because their job is to break even, not necessarily to make a lot of money. Some people think that our solution would be to have a national health insurance plan like they do in some other countries like Canada. But that would drive all these other insurance companies out of business, and we'd have to figure out how to pay for it. Hopefully, we can look for some answers as we go through the rest of the ABCs. Thank you for taking the time to listen to me today, and I hope you found this information helpful. Do you have other health insurance questions? Check out my other videos, or leave questions in the comments. Education is important, and that's why I created the Just the Facts Insurance Agency. It's just the facts you need to protect those you love.